Hi, I'm Dr. Jacob Teitelbaum, Medical Director of the Fibromyalgia Fatigue Centers and a board-certified internal medicine physician. I've had the honor of treating people with a myriad of illnesses over the last 30 years and have found that by using what we call comprehensive medicine, which is a mix of the best of natural and prescription therapies, people do the best. Now, it was a shock to me when I realized that almost all the information that we get as physicians comes from the drug companies. In fact, I started to think that the AMA and most of the medical profession is basically on drugs. What you'll find is that if you look at the journals where we get most of our information, virtually every advertisement is a drug company ad, and they are paying obscene prices to get positioned in journals and places where no doctor ever sees the advertisement. You'll notice there's no ads for Lexuses or golf clubs or things like that, because most companies would feel that they were out of their mind to pay what the journals are charging for that kind of placement. But the drug companies are happy to spend billions of dollars on those advertisements. And that's because they buy access to the journals. And the journals really don't want to piss off the advertisers. Drug company studies are much more likely to get published than natural studies of the same quality. And this has been shown in research that's been done. Now, if you look at the conferences that we have, almost every medical conference is paid for by the drug companies. And that determines which esteemed professors and speakers will give very nicely technical talks on the podium. Basically, all the information we get in the journals, in our conferences, and God bless them from those good-looking drug reps, because they're now hiring cheerleaders, comes from the drug companies. Now, physicians don't realize this. They just know that all of the esteemed professors who are heavily paid by the drug companies are telling them these very scientific-sounding things, but they don't realize that the research shows that if a study is paid for by the drug company, it is anywhere from 50% to 2,000% more likely to give a positive result than one that is paid for independently. What this means is that most of the research that we rely on as physicians that's paid for by the drug companies, which is almost all of it, is basically a lie. As the past editor of the New England Journal of Medicine said, to paraphrase, that most medical education is basically a big advertisement masquerading as medical science. So it's important to realize that the research done on so-called scientific studies on prescriptions really isn't very reliable. And with medications killing over 200,000 Americans each year, now the fourth leading cause of death in the United States, these are getting quite toxic. The good news is that by using a mix of natural and prescription therapies, and contrary to the propaganda that most physicians are given, natural remedies are very effective, and there's thousands of excellent studies showing that they work for many, many medical problems. But using the best of these natural and prescription therapies, you can get well safely and inexpensively. In this series, we're going to go through a number of common medical problems and teach you how to use comprehensive medicine, the best of natural and prescription therapies, so that you can get well now. This is Dr. Jacob Teitelbaum, wishing you great health.